Here doing my video regarding my second week of clinicals, and the question I'm going to answer with a couple questions I asked is how can athletic trainers and physical therapists work together to form a good patient-centered care team? First question I asked, and I actually asked this last week before I even knew about this assignment, was how would you see, or could you even see athletic trainers fitting in the clinical setting like I am right now, as working like side by side, and it pretty much came down to she believes that we could help, as in the fact that she would take care of the therapy to the point where the athlete was functional, as in like their balance is fine, their muscles are firing appropriately, and then we would take it over and we would take over the therapy to the point where we would have the more complex and sport specific therapy. So they're dribbling a basketball they're dribbling a basketball down the court while maintaining good balance or making cuts and stuff like that. So more sport specific therapy and less functional therapy as a normal person would. So we would handle the more sport specific side of the therapy. She believes that we could fit in and there would be a good relationship there between us two. The next question I had was more so filtered towards why is there some tension between athletic trainers and physical therapists, as they think we're stepping over the line, we think they're stepping over the line, as where's the line drawn in. She answered clearly there's a very gray area between where physical therapists and athletic trainers fit into the rehab session or rehab portion of it. And it all depends on personal preference. It depends on what the therapist feels comfortable with and what the athletic trainer feels comfortable with as far as the rehab. Maybe the therapist used to work and they used to be the sideline person for sports games, so they know sports specific training. Or maybe the athletic trainer used to work in more of a clinical setting, so they feel more comfortable with the more rehab and actual balance and recovery of function training. So there's a very gray area, and it comes down to athletic trainers and physical therapists having their egos get in the way of their work and getting very possessional over their patients. They think that they are the ones who can provide the best care when it should be a team thing. People don't like to admit that, hey, I really don't understand what I really not that I don't understand. I really don't know as well as you might what's going on here, and what do you think? They don't have the ability to ask for help, I guess, and that was her thoughts on that. And those were pretty much the two questions I had. I mean, I thought they answered many questions I had on the relationship between athletic trainers and physical therapists and why there's such a muddied water between the two. And it literally just comes down to people's egos and them thinking that they can't be wrong, and if they are seen as wrong, they'd lose credibility with their patients. I mean, people aren't perfect, and not everybody has the answer all the time. I'm not gonna admit I'm perfect ever, and I kind of am glad I am at this rotation because it's opened my eyes to understanding of how I can become the best athletic trainer possible when I am in practice.